Hi, I'm Dr. Keisha Powell. Welcome to another episode of the Dr. Powell Show. Today's topic is about aging and how it affects our mental wellness. Joining us today is a very special guest, CEO of Talk It Through Therapy, Miss Trudy Powell, who is a licensed clinical social worker. Stay tuned, and we'll be right back after the break. Hi, I'm Dr. Keisha Powell, CEO of Powell Therapy Solutions LLC and the host of the Dr. Powell Show. I'm a performance psychologist, a certified and licensed autism therapist, and a board-certified sexologist with the American Board of Sexology. Here at Powell Therapy Solutions, we're changing the dynamic of how persons diagnosed with autism spectrum disorders receive services and how treatment is delivered for trauma care. For more information, visit our website at powelltherapysolutions.com or email us at powelltherapysolutions@gmail.com. Remember, Powell Therapy Solutions, real support, real growth, and real inclusion. Welcome back to the Dr. Powell Show. With us today is Miss Trudy Powell. Welcome to the Dr. Powell Show. So I wanted to, aging is one thing that we have to go through. It's a natural process, but we also worry about those when you're older, whether you're in your 40s, 50s, and beyond. From your experience, how do hormonal and physical changes in older adults impact their emotional and mental well-being?
Thank you for bringing up this topic, Dr. Powell. This is a very interesting one for me. So I've been actually experiencing that myself. No one expects that to happen. We know it's going to happen, but when it starts, you're like, what's going on? So I just want to share a little bit about some of the signs, some of the symptoms, some things that I hear from clients, and some of which I've already experienced. So with aging, there comes hormonal changes. That's number one. As women, we understand there's going to be hormonal changes. What we sometimes often don't remember is men also go through these hormonal changes on their side. So there can be mood swings, increased anxiety, depression, sometimes even cognitive decline. And this is due to the estrogen for women, in that early menopause stage. So we want to be mindful of what's going on in our bodies, stay in tune to what we're feeling. And if there's any changes happening, consult your doctor, consult an older family member, friend, mom, whomever can enlighten that experience for you and guide you a little bit. Personally speaking, what I've done, with my own journeys, making sure that I'm giving myself and allowing myself the time to rest and relax. Super important, especially when we're dealing with hormonal changes and managing so much weight. So, I just want to make light of that as well.
That is so true. We don't really think about men as much as we emphasize a lot of stuff that women are going through, but men go through stuff too. And so, what connections have you seen between chronic health conditions, physical pain, and the onset of depression or anxiety in seniors?
Well, and I just want to share this too. I've worked extensively with seniors in what we would call the residential facilities. And I did a tenure at a particular one local here in Florida for about 3 years. And that experience as a social worker kind of opened up my eyes to understanding what that age-related adjustment process is and the complications that come along with that. I've experienced and now enlightened to the cognitive decline, the isolation, the depression, the likelihood of disease increase. Emotions are connected a lot with the disease production, right? And the onset of new diseases. Because when the nervous system is suppressed or we're not in our full function, our body reacts to that. So I've seen vision loss, I've seen paralysis, I've seen the cognitive decline, I've seen depression, I've seen clients that I've had not see their family members for a month, 2 months, 3 months, and soon after that they feel so destitute and lost that they give up, and it leads sometimes to death. So, I've also made mention to the staff there, let's invite the families, let's gather the staff, let's love on them to the best capacity. And some cases didn't go so well, and you do what you can, but we also need to be mindful. Let's love on the older population a little bit more and give them a little bit more attention because they are also needy. I want to point that out.
That is so true. I had the privilege of taking care of my parents for over 19 years, and I can tell you, it was not just only culturally for me, but it was something I wanted to do because my parents were great parents,
Mhm.
and to be able to take care of them at home versus putting them in a nursing home, I realized there was so much of a difference with them in comparison to other elderly people that I've seen before. And, I want to point out to viewers how important it is, even if that person doesn't have any children. Sometimes going into the nursing homes and talking with the elderly, and you see elderly neighbors, check on them because it's really important as we age. We are connected mentally, but also it does affect us physically, which goes into my next question about how do age-related changes, because I've noticed you've talked about condition a little bit earlier, how does it affect, memory or cognitive function, in terms of their identity and self-worth? How does it impact that?
So it has a heavy impact. Just think of it and picture yourself in this equation, right? In this question you posed. Functional Dr. Keisha Powell, pays her own bills, responsible for this and all the other areas in your life, right? And you get to a point where you start losing that memory, you start losing that independence and functionality, and you're left with this question in your mind: who am I? What am I worth? My identity is no longer what it used to be. And for parents, their children may be now parents and or grandparents. And you lose that role as mom, you lose that role as dad. Now you're this person who is dependent on someone else to maybe wipe you, care for you, feed you. That does something to someone, and over time, added to the natural deficits that happen with aging, the memory loss, the confusion, the role identity, the social isolation, the loss of independence, the fear of dementia and what that would look like. Even the stereotypes and the pressures around that can also be complicated. So there's a plethora of age-related issues that normally we don't talk about, and we don't think about that with our loved ones. And, I think this discussion is quite important just to highlight that for us and the significant of what that would look like and feel like when we do get to that age. So,
So Ms. Powell, as a clinician, when do you think caregivers or the elderly, when should we start that conversation? At what age do you think we should?
Um, I don't think there's a one answer specifically to say yes, start at 50 or start at 49 or start at 70. I think along the way and along the journey of adapting and changing roles in life, we should try to maintain the solid connections and relationships we do have with our older population. And for us as we age, I think it's incredible to develop a unity, a community around what you're going through and talk about that and spread light and gain support. You know, there shouldn't be a space where you're going through something and there's absolutely no one to communicate with. So I encourage, and I preach this all the time everywhere I go, develop a community. And let me add to that for a minute. You may hear the word community and you may think more than two people. That doesn't have to be a community. Your community could be you, your sister, you, your cousin, you, your best friend, you, your partner, whomever that may be. Where that safe space is where you want to create that open dialogue about what's going on, what am I feeling? Um, and I always say, if that's not effective and if those spaces are not as safe as you want them to be, reach out to a professional who has that history and expertise in dealing with late stage adjustment disorders and life situations. Um, there is a diagnostic code and term for adjustment for the elderly. It's adjustment disorder. But I like to use the terminology as growing with grace because it's going to happen to everyone. I
I
hate
love it. I love that.
I hate using the diagnostic term, like, why are you talking to me with diagnostic terms? So I just say aging with grace, um, frame framed in a positive way. So I just encourage talking because it helps.
I love that. I mean, I can just imagine when your patients hear you and how they feel about it. In your work, how have, because I'm always curious about this one.
Mhm.
How has like hearing or vision loss influenced an older person's ability to stay connected socially?
It affects everything we do. Just as I said before in answering the important question prior, just imagine yourself not being able to see, not being able to hear clearly, or then not at all. And imagine what quality of life and that reality would look like and feel like for you. And I pride myself in having the skill set to put myself in someone else's shoes with empathy, right? Not sympathy, empathy. And imagine that life. What would that feel like? For that elderly person or aging person, the communication difficulties, the withdrawal, the reduced social network. And I want to share this too. Like, I have a client that I'm currently seeing, weekly appointment. She's also in an aging adjustment phase of her life, growing with grace. Um, and the funny part about our conversations is I hold space for her ongoing, right? And that's her safe space. But the humorous part of it for me and I receive is we'll have a conversation the week before and we'll have a conversation this week. And she's saying the same things she said the week before, as if it's the first time she's ever reported it. Now, as a therapist, in the field of taking care and holding space, I'm not going to say to her, hold on,
Mm.
client, you said this to me the week before. Are you forgetting? I'm not going to point that out. I'm going to act as though, wow, this is the first time I'm hearing this. So you're not making emphasis on that as a deficit for them.
Mhm.
Do you get where I'm coming from?
I
It's
get
like
what you're, yeah. Hmm.
it's just going along with the motion. So a lot of it is just having them not feel like there is something absolutely strange or wrong with them,
Hmm.
in a gentle, supportive way. So, hopefully that answers the question a little bit.
It does. It does. As a person who is, I'm partially blind and partially deaf because of a car accident. And I remembered how difficult it was to deal with, even though I'm also a trained assistive technology specialist, to adjust, to accept, and to then regroup was difficult. So I cannot even imagine what it would be like for an elderly patient. So, in closing, what strategies do you recommend to help older adults maintain physical activity and a lifestyle that, supports their mental health?
There are different answers to that question, but I'll lead by saying this. With building rapport with anyone who is aging, no matter what age it is, do not treat them like they're invalids. The moment they feel or then receive that energy from you, that there's some dependency from them to you, it sets them to then think of themselves in that way. So you want to empower. Secondly, this is super important. Find out what they like to do. And I have been shocked with the amount of things that the elderly love to do, right? I've learned so many new things from them creatively. I've learned, how to stitch. I've learned how to, paint. I had a client that she was 96 and she could recall everything from her life, but it was on repeat. Every single,
Wow.
it was a full repeat and a full story. But what I learned from her is there are special moments in her life she will never ever forget. Never ever forget. And like it was just yesterday. And I leaned into that. And that was fun for her. And she loved playing, doing puzzles. So I'll go into the room and she would have the puzzle book ready because she knows her appointment. And I would sit and just do puzzles with her. Join into the things that they enjoy. Encourage them to do some form of social interaction and also physical, and it may not be physical to what we think. It may be a walk, it may be pushing them in the wheelchair to go out in the sun. Anything that they can do that could be physical, maybe putting their hands above their heads, clapping, singing, whatever it may be. Physical activity is good to stimulate the brain. It allows you to feel relaxed. They feel alive, feel vibrant. So you can do different things, but at the end of the day, find out what they like and encourage them. And diet, also make sure you're checking in on diet and dietary restrictions, and just structure a routine around that. That's all.
Thank you so much. This has been an enlightening episode, I have to say. I wish I had known a lot of these things because for me, it was trial and error trying to figure out stuff. But I will say I made some very great connections with like the visiting registered nurse because you do need to have a tribe, as you say, a community of people, doctors, nurses' aides. It's very important for that to happen. And thank you again so much for the work you're doing. How can viewers find you if they ever want to talk about their elderly care or, probably just talking about what was the new diagnosis again?
Adjustment disorder, but
Adjustment disorder or
aging with grace.
aging with grace. You should have a program on that.
I
Aging with grace. I
know.
like that. I like that. How do they find you?
So before I tell the viewers how they can find me, I just want to, because I did an article on this just the other day. It's making sure the caregiver is cared for. Like if you're caring for someone, make sure that you're doing what you need to do to fill you first. Make sure that you're taking care of you, because that's a heavy, heavy job. You can find me on my website. My website is www.talkitthroughtherapy.com. You'll see how to book a session with me, a 15-minute consultation session, hours and times and so forth. And you learn a little bit about me and why I became a therapist and kind of like what I do as a model. And you can find me there in that space.
Thank you so much for being on the Dr. Powell Show. Please visit Talk It Through Therapy website to connect with Miss Trudy Powell, licensed clinical social worker.
I'm licensed in Florida, just for the viewers, and Indiana, currently working on Virginia and Pennsylvania. So those will be announced and listed on the website as well. But thank you, Dr. Powell, for having me again. I appreciate it. And we need to have more discussions around this topic. Thank you so much.
Thanks again for joining us on the Dr. Powell Show. I'm your host, Dr. Keisha Powell. If you should have any questions about this episode, please email us at powelltherapysolutions@gmail.com. And don't forget to donate at givebutter.com/helpcvc. Until next time. Hi, I'm Dr. Keisha Powell, CEO of Powell Therapy Solutions, LLC, and the host of the Dr. Powell Show. I'm a performance psychologist, a certified and licensed autism therapist, and a board-certified sexologist with the American Board of Sexology. Here at Powell Therapy Solutions, we're changing the dynamic of how persons diagnosed with autism spectrum disorders receive services and how treatment is delivered for trauma care. For more information, visit our website at powelltherapysolutions.com or email us at powelltherapysolutions@gmail.com. Remember, Powell Therapy Solutions, real support, real growth, and real inclusion.